Hi, my name is Nora. I'm going to be your nurse today. How are you?
I'm good.
Can I get your name and date of birth?
Jane Doe, 010902.
And Jane, can you tell me where you are today?
Clinical setting.
Awesome. So my patient is learning oriented times 3. So Jane, I'm going to be performing a head to toe assessment. I'm just going to be focusing on your muscular system, your reflexes, and we're going to be walking a little bit. I'm also going to be inspecting your abdomen, so I will be kind of listening and touching around. Is that okay?
Mm-hmm.
Are you experiencing any pain that I should know about before we start? Okay. Overall, my patient looks comfortable. She's learning oriented. Her skin is normal for ethnicity. I don't see any obvious bleeding or diaphoresis, so I'm going to go ahead and begin. I'm going to start with the upper extremities. I can see her clavicles. I can see her scapula. I can see her elbows, her wrists, and I don't see any abnormalities that I should be aware of. Next, I'm going to touch. Please let me know if I cause you any pain. So, excuse me. I'm going to be palpating her joints. Any pain?
No.
Any pain?
No.
Here?
No.
And then while I'm here, I'm just going to be also feeling for her pulses. I'm going to do brachial pulse, even on both sides, and radial, even on both sides, +2. So next, I'm just going to test your strength. If you can just put your arms up like this, I'm going to grab your wrist and pull. You pull against me. Okay? And then put your hands like this and push. Alright, so my patient was able to do that. Next, we're going to do range of motion. So if I can have you extend your arm out and return it in the other arm. And now out in front of you. And the other arm. Any difficulty doing that or pain?
No.
Okay. And now if we can just test your wrist. Awesome. Next, I'm going to test something called graphaphasia. I'm going to ask if you can hold your hands out, close your eyes, and in each palm, I'm going to draw a figure. Just tell me what figure you feel me drawing.
The letter A.
Okay, and then this one?
The number 8.
Perfect. Next, if you can also keep your hands out, arms out, close your eyes. And here we're looking for a pronator drift, if her arms drift from one side to another, and she doesn't, so she's negative with the pronator drift test. Next, before we move on, if you can do some range of motion with your neck with me. So, chin to your chest, and then back as far as you can. And then if you can put your ear to your shoulder, and the other side. Any difficulty doing that?
No.
Perfect. So next I'm going to have you lie back, and we're going to do the abdomen portion. And I'm just going to pull your shirt up a bit, okay?
Mm-hmm.
Okay, so we have my patient's abdomen. Visually, I'm inspecting for any bulging, distension, if I see any bleeding, bruising, if I see any masses, and I don't see any of that. Before I can start touching and manipulating any sounds, I'm going to listen. So what I'm listening for is your like digestive noises. I'm listening to see if I hear any bowel sounds. So I'm going to go over the right lower quadrant, and I'm going to listen over each quadrant for 5 to 10 seconds. And I hear some sounds. Moving on to the other quadrant. I hear it. I hear it. Present. Awesome. So I hear normal active bowel sounds in all 4 quadrants. Next, I'm going to palpate. I'm going to palpate each quadrant twice, one light and one deep. Please stop me if you feel any pain. Starting in the right lower quadrant, just lightly palpating. And I don't feel any masses or any hardening. Now I'm going to go a little bit deeper. And in the right upper quadrant, I don't feel the liver, so I'm palpating for the liver, but because I don't feel it, that's a good thing. And then in the left upper quadrant, I'm feeling for the spleen, also can't feel it, so that's good as well. Then I'm gonna palpate your sides for your kidneys. So on this side, you can just take a deep breath. Okay, and repeat. Okay, so I don't feel it, which is a good sign. You can come back up. Thank you. So next, I will have you, I'm just gonna palpate your hips for a moment. Right here, any pain?
No.
Okay, then I'm gonna also palpate your knees and your ankles. Any pain?
No.
Okay, I'm also gonna feel for your pulses. This is your popliteal pulse, your posterior tibialis, and your pedal. Awesome, even and +2 on both sides. Next, we're gonna do something called the heel to shin test. So I'm gonna ask if you can take one heel and rub it up your shin, and do the same for the other side. And she's able to do that with no difficulty, so that's great. So also, we're gonna do some range of motion. So if you can move one hip up, down, another, down, extend your leg, and the other leg. And then also your feet, and the other one. Great. Next we're gonna do your reflexes. I'm gonna start with the reflexes in your arms, in your knees, and then I'm gonna ask if you can turn around and I can chest them in your Achilles. So first we're feeling here. Okay. So +2. So if you can just sit back a little bit and have your legs dangle. Just relax your legs. Yeah. Okay. Okay. +2. Then if you can just stand up and lay on your stomach for a moment. And then what I'm looking for here is just the Achilles. Okay, +2. Okay, thank you. So while I have you standing, I'm just gonna have you turn. And we're gonna look at her spine. Her posture is well aligned, no deviations to one side. I can feel all her cervical columns. And then I'm gonna ask if you can turn to me. Bend forward, and then bend back, and then twist. Any pain?
No.
Okay. So now I'm just gonna have you just normally walk, and then walk back. She's not swaying to one side or having difficulty with balance. Next, can you just walk on your tiptoes? Great. And then walk back on your heels. Awesome. And now can you go from your heel to your tiptoes? Good. And then the last thing we're going to test for is the Romberg sign. So it's just standing with your hands to the side and your eyes closed. And she can do that for about 10 seconds without swaying to one side or another or having difficulty with balance. So that's a negative Romberg sign. Okay, Jane, we've completed our head to toe assessment. Do you have any questions for me?
No.
Awesome. Thank you so much.
Thank you.